Hi, I'm Dr. Hagmeyer. In today's video, we're going to talk about the 12 signs of an underactive thyroid. Maybe you've been suspecting a thyroid problem for quite some time, and you went to your primary care doctor complaining of low thyroid symptoms, only for your doctor or the nurse to call you and tell you that your thyroid is fine. There's no problem with it. Is it possible to have a thyroid problem with normal thyroid testing? And this is a really tricky question, and a question I find myself discussing with prospective patients every day. And there's a lot that has to do with the kinds of tests that were run, but today the purpose and the focus of what today's video is going to be on is the most common symptoms that are associated with it. All right, so let's dive into some of these symptoms a little bit, and then I'll let you know what you can do if you can relate to 4 or 5 of these symptoms as we discuss them. So number 1, do you feel tired and sluggish, right? This is a pretty common complaint, I think, by a lot of people, and so it's one that can be easily written off, right? We can write this off really easy because life is busy, right? For many women, perhaps you work, perhaps you own your own business, you have kids, you have sports, you have lunches, you have breakfast, you have dinner that you're making and that you're preparing for, you have homework that you're doing with your kids, your mornings are super busy making lunches and getting your kids off to school and catching a bus, maybe driving them to school, all meanwhile your husband doesn't do anything. Just kidding. But this is obviously a real easy area where we can write off and minimize just the level of fatigue that we're experiencing. Number 2 is just feeling cold, right? Do you experience the tips of your feet or your nose or your fingertips being cold on a regular basis, right? Everybody else around you is comfortable, but you always seem to be a little bit cold. And the reason for this is if we think about our thyroid gland as the metabolic furnace of the body, if you will, if it is sluggish, just like a house that's going to get cold if the furnace doesn't work right, we're going to have a low body temperature. And this is one of the reasons why many women that suffer with thyroid problems experience feeling cold on a regular basis. Number 3 is, do you require excessive amounts of sleep in order to function properly, right? Do you go to bed at a reasonable hour, let's say, 10:30, and you wake up at 6 or 7, and you feel just as tired as you were when you went to bed, right? Do you feel like you never rested? Do you feel that without that morning cup of coffee or that stimulant or that caffeine, that soda, that sugar, you're never going to make it through the day, okay? When I see these symptoms, in addition to fatigue, it makes me start thinking about why it's so important to get a complete thyroid panel so that you can see a better aspect of what's going on with the thyroid, okay? And so in this case, not only when we see this feeling cold, but also this fatigue, I also start thinking about another connection, which is the thyroid-adrenal connection. We've talked about this in a past video. Number 4 and number 5 deal with weight gain. Okay, in the last 5 years, I've seen so many patients do just such a fantastic job at eating super clean. Honestly, in the last 5-10 years, I have more patients eating just amazingly clean, yet they're still suffering with fatigue. They've cut out all the junk food. They've cut out all the rices and the pastas and the sugar and all the excess carbs. They've cut out gluten. They've cut out dairy, and yet they're still gaining weight. All right? They've cut out all these empty calories. They're not drinking their calories in their coffee, for example. They're exercising 4 or 5 times a week, and yet they're still struggling seeing that weight come off and keeping that weight off. Okay? This, again, is a red flag to me that there's an underlying thyroid problem regardless of what any lab test or what your doctor may have told you. I'd also like to add one point when it comes to weight gain in the thyroid, and what I would say is that for many of the patients that I work with, they'll notice 1 month that they're gaining weight, and a few months later, they're losing weight. Now, if this is you, and let's say you're a medium to a smaller build, or you're on a thin build, in this case, I begin to think about an autoimmune disease called Hashimoto's disease. This is where the immune system begins to attack the thyroid gland and destroy the thyroid gland over years and years and years. It's a progressive disease where, again, like I said, the immune system is really the problem, and it's the immune system that's selectively targeting your thyroid gland, okay? Number 6, do you find yourself depressed and anxious? Okay, this is an incredibly common problem that I see in many patients, and I would actually argue that in all the patients that I've worked with, I rarely see anxiety and depression without some degree of thyroid problems. And the reason for this, in many cases, comes down to inflammation and the connection between inflammation and the thyroid gland. One of the common problems that we often see in this situation is something called low T3. Number 7 Okay, difficulty or infrequent bowel movements or other gastrointestinal problems. While this is not the most obvious symptom one might think about when it comes to the thyroid, nevertheless, it is very important. And I would argue that in many of the cases that I've worked with, I see this component 50 to 75% of the time, gastrointestinal problems connected with the thyroid. Okay, so these might be problems, for example, where you feel constipated or you feel bloated or you have abdominal pain. Maybe you have diarrhea, maybe you have acid reflux, maybe you have gas on a regular basis, maybe you have a coated tongue, maybe you have bad breath, okay? If you have any of these things, again, this is a common consequence of low thyroid function. And again, if you notice this happening, you may not have enough stomach acid to properly break down these foods, or you may have some other underlying GI issue that's going on. Now, the GI system is a very important area that influences the thyroid in so many different ways. Not only does the bacteria in our gut convert T4, which is the inactive thyroid hormone, into the active thyroid hormone, which is T3, but the gut's also responsible for the absorption of many of the vitamins that become such a critical part in, in combating fatigue. For example, our B vitamins. B vitamins and actually even vitamin K is made by the bacteria in our gut, and we all know that many times these B vitamins, when we are low in these B vitamins, we do experience fatigue. Another common vitamin deficiency we see is low vitamin D, okay, low iron, low zinc, okay, these are all signs that we may need to look further into the connection between the thyroid and the gut. Again, B vitamins are the energetic vitamins, but they're also the vitamins that are known as the anti-stress vitamins, okay? So B1, B2, B3, B6, B12, they're all very, very important in terms of helping convert the food that we eat into energy, okay? And again, another common problem in thyroid patients is the connection between small intestinal bacterial overgrowth and the thyroid. And again, if you're interested in that, you can watch a video that I've talked quite a bit about SIBO, or small intestinal bacterial overgrowth, and the thyroid gland. Okay, that brings us to number 8. Number 8 is irregular menstrual cycle or even male hormone imbalances. While most women assume that an altered menstrual cycle is only caused by sex hormones like progesterone and estrogen, the truth is that your sex hormones are influenced by the thyroid as well. In fact, not only can your thyroid affect your menstrual cycle, but your sex hormones, estrogen, progesterone, testosterone, can also affect your thyroid. And the same goes for men. Men are just as much at risk because men can suffer with a condition known as andropause, where despite having normal testosterone levels, the elevated levels of estrogen in a man can then begin to suppress their thyroid function, okay? When I see a list of male or female hormone imbalances, I always want to run a comprehensive thyroid panel and a sex hormone panel where I'm actually looking at various lab biomarkers. And some of the ones I really like to look at, and if you have a pen you may want to write this down, is something called sex hormone binding globulin. And the reason being is that if this is high or low, your thyroid is affected by this hormone imbalance. Okay, so again, this is the thyroid hormone connection. So sex hormone binding globulin, when this is elevated or depressed, you want to start thinking about the possible relationship that exists between the thyroid and your sex hormones. Now, symptoms number 9 and 10 deal with hair loss. Okay, sometimes the hair loss is on the head, sometimes it's just the outer third of the eyebrow, or sometimes it's even around the genitals in the pubic region. Okay, there are many, many hormonal imbalances that can also cause hair loss. And I have done a video that kind of goes over the main hormones that we look at as it relates to hormones and hair loss. So again, that's a video. If that's something you're experiencing, you want to know more about those hormones, you can easily watch that on our YouTube channel or even on our website. Okay, so again, if you're a man or a woman and you notice this hair loss, I highly, highly recommend that you get a complete hormone panel as well as a nutritional panel, because there are lots of many different kinds of nutritional imbalances that can also lead to hair loss as well. Number 11 is dryness of the skin and the scalp. Here again, while this may not be one of the more common, thought of symptoms associated with low thyroid, it is a fairly common scenario that I see with patients that are hypothyroid. And again, it's pretty hard to correct these problems where there is dryness of the scalp or skin conditions and things like that when we are hypothyroid and you don't address them. Now, common skin problems that we might see might include things like eczema or things like psoriasis or even hives and acne and even rosacea, okay? This could all be coming from the gut Could be coming from nutritional deficiencies, could be coming from a hormone imbalance, but it also could be coming from an established connection to the thyroid gland. And again, I have done another video on that as well, titled Skin Conditions and the Role that a healthy gut plays for that, okay? And our last symptom, number 12, is brain fog, change in mood, or a loss of mental stamina, okay? This is, again, these are very, very common problems that I see in my patients with low thyroid or low T3, or even high reverse T3. So you can't focus, you can't concentrate, you read a sentence and you have to reread it because it didn't register. Your head feels heavy, you feel like your head is surrounded by a big cloud, okay? You make mistakes at work. Maybe you have to, again, read something over several times, you forget where you're parked. You know what I mean when we're talking about brain fog. But you lose your temper, right? You're easy to get fired up. Okay, if this is you and you find yourself with this symptom occurring, this is another reason why, again, a complete thyroid panel becomes so important. And when I say complete thyroid panel, I mean more than just a TSH and a T4. So again, if you have more than 4 or 5 of these symptoms and your doctor or nurse told you that there's nothing wrong with your thyroid, I can't overemphasize enough that you really need to get a complete thyroid panel. And so that's going to wrap up today's video. If you're looking for more information on understanding your thyroid lab values, I have put together a free guide that you can get on my website. It's called The 6 Patterns of Thyroid Disease That Don't Show Up on Routine Standard Blood Testing. Again, if you're watching this on YouTube, then what I'll do is I'll put a link on this with a description to today's video, and it'll take you to our website where, again, you can download that free guide and, of course, get that very valuable information. So again, if you're watching this video on YouTube, I recommend that you watch some of the other thyroid videos that we've done, especially start perhaps with the videos that I've done on the frequently asked questions. Okay, so there you have it, the 12 symptoms of thyroid disease and when it's necessary to get a complete thyroid panel. And so if you like today's video, please be sure to give it a thumbs up. Make sure you subscribe to our YouTube channel. And again, comment in the section below if there's more information that you want to know about certain aspects related to the thyroid gland. Until next time, take care.